Hi class, good day. So for today's discussion, it will be all about human viral infections. So let's start. What is virology? Virology is the study of viruses, and virologists are the people or professionals and scientists that are behind virology, meaning they deal and study with the viruses. So this is just a quick recall because this is already discussed in your previous lectures and SAS module topics. So we'll just recall the viral structure. So virion is the whole viral structure, and this is the structure of the virus. It's either RNA or DNA. So the genome is always either RNA or DNA. It can never be both. DNA, because DNA, it means all are double stranded except parvovirus. RNA, all are single stranded except reovirus. Okay, since viruses class are classified as RNA viruses or DNA viruses. Again, all DNA viruses are double-stranded except parvovirus, and all RNA viruses are single-stranded except reovirus. Next, it does not contain structural elements required for protein synthesis, meaning it does not contain ribosomes. Aside from ribosomes class, it does not also contain mitochondria. It has also no nucleus, and it does not exhibit motility because your virus is said to be an acellular microbe. Again, virus is an acellular microbe. Next, viruses replicates in host cells. They are strictly obligate intracellular parasites. They should be within a host. They needed the host in order for them to survive and generate energy and nutrients for themselves. Again, your viruses needed a host. Okay, so the virus structure contains this. Again, let's just recap. You have the viral nucleic acid, either RNA or DNA. It is also this viral protein, the capsid, and the viral lipid envelope, and your viral glycoprotein spikes. Viral lipid envelope and glycoprotein spikes are not available, or you cannot see this in all of the viruses because there is this what we call envelope and naked viruses. When you say envelope, I mean naked viruses, they do not contain the envelope. So, naked viruses does not contain viral lipid envelope and viral glycoprotein spikes. Again, structure of viruses: viral nucleic acid, viral protein, viral lipid envelope, and viral glycoprotein spikes. However, there are viruses like the naked viruses that does not contain viral lipid envelope and viral glycoprotein spikes. For example, your COVID-19, your SARS-CoV-2 virus responsible for COVID-19 disease coming from the family Coronaviridae is an enveloped RNA virus. Okay, let's proceed. These are the different DNA and RNA viruses. This is again another quick recall so that you'll be able to catch up or understand as we discuss in the succeeding slides. So the DNA viruses, this mnemonic is not mine. We've been using this since college. So I'm just borrowing this mnemonic to share with you so that it will be easy for you to remember the DNA and RNA viruses as well. So DNA viruses, this mnemonic, pa-pa-ad-po, he-he. That means pa, papillomavirus, parvovirus, adenovirus, poxvirus, herpes virus, and hepadna virus. The RNA viruses are all of the rest except papa, adpo, he. Again, all of the rest of the viruses that are not mentioned, except this Papa Adpo Hehe. So it will be very easy for you to remember now the DNA viruses and RNA viruses. Pax virus class is the largest and most complex of all the viruses. So again, Pax virus, largest and most complex of all the viruses. Next, how do viruses cause disease? Virus can only affect cells bearing the appropriate surface receptors. This means that viruses recognize and attach to a specific receptor. They're always specific, and then by the time that they attach, they multiply and produces more novel or baby viruses within the host cell. For example, your SARS-CoV-2 virus responsible for COVID-19 binds to ACE2 receptors. This is very specific to ACE2 receptors of the alveolar cells of the lungs. So, since it is specific to the organ or to the part that it is in the alveolar cells of the lungs, there will be clinical manifestations will be respiratory infections, and that includes pneumonia. And worst case that we observe now from COVID-19 patients is they are experiencing difficulty in breathing. Okay? If viral, what happens even though our immune system works is that if this viral replication class overwhelms or they actually outnumber the ability of our immune system, that's the time viral diseases occurs. Okay? Because there are really times that, especially when you are for immunosuppressed individuals, those who are already having comorbidities, and those also individuals who are very stressed, who's not really immune system are boost or strong enough to fight infections or viral infections in this case, then that's the time that diseases will likely occur. Okay, next. So first, let's have the viral infections of the skin. For the viral infections of the skin class, first, as we have chickenpox and shingles. I guess most of us already experienced chickenpox. I experienced this when I was 7 years old, and it's really itchy and painful. That time, the causative agent is your varicella zoster. Causative agent for chickenpox and shingles are the same class. It comes from the family, or it belongs from the to the family herpes viridae, and it is transmitted from person to person, direct contact, droplet or airborne, vesical fluid or secretions of the respiratory system of persons with chickenpox. Infected humans serve as a reservoir. Your chickenpox class is said to be a self-limiting disease, meaning it can be treated and is manageable without treatment. However, even though it's mild and self-limiting disease, it can also lead to complications like Rice syndrome. Rice syndrome is a severe encephalomyelitis and liver damage, and this is more likely to occur in children with chickenpox and are given with aspirin. Okay. Other complications include pneumonia, encephalitis, and other bacterial infections. Your varicella zoster virus is also known as your classic childhood disease. Okay. This is a clinical picture of a patient with chickenpox. Okay. This is a vesicle. This is a type of skin infection wherein there is fluid inside the sac. Okay, can you see it, class? And this is a papule type of lesion. This is a surface lesion only in which it is firm and raised. Again, this is a clinical picture of patients with chickenpox. Shingles, on the other hand, is a reactivation of your chickenpox. Okay, this is true to individuals who are really immunosuppressed or immunocompromised, especially to older individuals beyond 50 years old. Okay, again, shingles is a reactivation of your chickenpox. Let's proceed. This is German measles. Causative agent is your rubella virus from the family Toga viridae. It is transmitted by droplet spread, direct contact with nasopharyngeal secretions or infected people. The reservoir here includes infected humans. Rubella may cause also congenital rubella syndrome in the fetus. So this is the rashes. It appears to be pinkish rashes within 1 to 2 days after the onset of symptoms. And other symptoms include mild and febrile disease for patients. Remember, rubella is milder than the hard measles. This is a rubella measles. This is hard. I mean, this is milder than the hard measles, which we will discuss in the next slide. Excuse me. This is the hard measles class. The causative agent is your rubiola virus, family Paramyxoviridae. It's an airborne spread and direct contact with nasal and throat secretions of infected persons. The reservoir are also infected humans. So in measles, you'll be able to observe macule type of skin lesions. These are neither raised nor depressed type of skin lesions. Also, cochlear spots. Cochlear spots are small white spots in the mouth. So this is how it looks like, your cochlear spots and your rubiola measles. Okay? Complications include bronchitis, pneumonia, otitis media, and encephalitis. Next, monkeypox. Sorry, monkeypox. Monkeypox. Causative agent is monkeypox virus or orthopox virus from the family Poxviridae. This can be transmitted through animal bite or contact with an animal's blood, body fluid, or rash. Monkeypox is actually a zoonotic disease class. Reservoir also include infected humans. Person-to-person transmission is also possible. Okay, but this monkeypox is a very rare viral disease class, and this is rarely fatal than that of the smallpox. Okay, other symptoms aside from rashes, which is shown in this picture, includes fever, muscle aches, lymphadenitis, and again, rashes. Okay? Smallpox. Smallpox is already eradicated in the year 1977 class. The causative agent is the variola virus, the variola major, and variola minor. It comes from the family, again, Paxviridae, same with monkey virus. It can be transmitted from person to person via droplet spread or skin inoculation. Patients are most contagious before eruption of the rash by aerosol droplets from oropharyngeal. Okay? Smallpox has rashes similar to chickenpox. That's why it should be distinguished. And other symptoms aside from rashes include fever, severe backache, skin rashes as well. Okay? This picture here in the upper right is this shows variolation type of immunization. This happens way back 1500s in China. That's the first experimental event or immunologic event that happens in China when people are infected with smallpox. By that time, they have this type of immunization. This is what you call again variolation. Using a long tube, the patient infected with smallpox is going to inhale the powder of the smallpox cubs, and by that it can already provide immunity and protection um, to their body from the pathogen. Not until Edward Jenner that there is a already discovered that cross immunity between cowpox and smallpox antibodies which actually work, and that's the time vaccination is already happening, or that's the birth of vaccination already. So thanks to Edward Jenner. So this class is a smallpox infection during the 1500s in China. Okay? Your smallpox, by the way, is limited to humans, unlike the monkeypox that is also zoonotic. Smallpox can become severe with bleeding into the skin and mucous membranes, followed by death. And it is said here that smallpox is a potential biological warfare and bioterrorism agent. Next, warts. Warts, the causative agent is your human papilloma virus from the family Papoviridae. They are transmitted via direct contact, or it can be also through sexual contact. There are genital warts that are actually sexually transmitted. The reservoir includes infected human, and these are the different types of warts. It could be common warts, venereal warts, and plantar warts. Among the 70 types of HPV, most are actually harmless, but some can be cancerous, like this type HPV type 16 and 18, which is responsible for cervical and penile cancer. Okay? Next, viral infections of the eye. You have here adenoviral conjunctivitis and keratoconjunctivitis, which is caused by your adenovirus from the family Adenoviridae. It can be transmitted through direct contact with eye secretions or contact with contaminated surfaces, instruments, or solutions. So, symptoms include photophobia and blurred vision. It can be diagnosed through cell culture and immunodiagnostic procedures. So in here, the cornea is involved in about 50% of cases, with permanent scarring of the cornea in severe cases. Actually, the picture here for adenoviral keratoconjunctivitis is almost similar with that of um, pink eye conjunctivitis caused by your Haemophilus aegyptus bacterium. But the only difference is in Haemophilus aegyptus pink eye conjunctivitis, the conjunctivitis appears to be purulent or pus forming because of the bacteria. For adenoviral keratoconjunctivitis, it's more on a watery conjunctivitis. Okay? Next, hemorrhagic conjunctivitis, causative agent adenovirus or enterovirus. It can be transmitted through direct or indirect contact with discharge from infected eyes. It may be associated with poorly chlorinated swimming pools. So it can be called swimming pool conjunctivitis. So as you can see in the picture, hemorrhagic, there is bleeding or damage of blood vessels. So signs include redness, swelling, pain in one or both eyes, and there is also subconjunctival hemorrhages. So this is the clinical picture of hemorrhagic conjunctivitis. This pharyngoconjunctival fever may also occur. This is your adenoviral syndrome. The that is actually the upper respiratory tract and corneal inflammation. So again, what is being affected in this pharyngoconjunctival fever is the upper respiratory tract and the cornea. Next, we're already in the respiratory tract viral infections. So, COVID-19 disease or your SARS-CoV-2 is under here. Okay? But we will not include it in the discussion class, okay? But we will be talking also about SARS, which is related also to COVID-19. Okay, first we have the common cold or acute viral rhinitis. This is different with allergic rhinitis. This is caused by a virus and also called acute coryza. Causative agents could be rhinovirus. Other causative agents includes coronavirus, parainfluenza virus, respiratory syncytial virus or your RSV, influenza virus, adenovirus, and enterovirus. This can be transmitted through respiratory secretions by the way of hands and fomites or direct contact with or inhalation of airborne droplets. So common cold, even though you have a common cold, it does not really offer protection to the next to other serotypes, because rhinovirus, the most common causative agent of common colds that we experience from time to time, is actually having more than 100 serotypes. So imagine, ang dami. So it will not be easy, or it will not be that accessible for the memories of our immune system to familiarize all of this. That's why even though we already experience common cold, it keeps on happening again the next month, the next time, or within a period of time, because our immune system cannot actually right away build memories against, or antibodies, produce antibodies against these serotypes, because there are many serotypes. There is no vaccine to prevent colds, and other symptoms in your common cold includes headache, runny nose, nasal congestion, and sneezing. Okay. Next, viral infections of the lower respiratory tract. Kanina is upper respiratory tract. This time, lower respiratory tract. You have acute febrile viral respiratory diseases. Causative agents, you have parainfluenza virus, RSV, the respiratory syncytial virus, adenovirus, rhinovirus, coronavirus, Coxsackie viruses, and echovirus. Your RSV class is a major respiratory disease among infants, usually from 6 months to 2 years old. It may cause pneumonia, croup bronchitis, otitis media, and worse, death to infants. What is croup class? There is obstruction in breathing, and it actually manifests or shows barking cough. Okay, so that's croup. The transmission here is through direct oral contact by droplets, or it could be indirect contact by contaminated fomites, and also fecal oral route. Next is HPS, your hantavirus pulmonary syndrome, which is actually caused by the inhalation or transmitted by inhalation of aerosolized rodent feces, urine, and saliva. Causative agent is your hantavirus with different types. It could be Sinumbre, Bayo, Black Creek Canal, New York 1, and Monongah, Hela. Sinumbre is also called your virus with no name. Okay. Other symptoms include cough, fever, muscular pain or myalgia, and difficulty in breathing, as well as hypotension or decrease in blood pressure. Reservoir here are primarily rodents. It could be also mice, packed rats, and chipmunks. For HPS, there is no person-to-person transmission. Next, influenza, or we commonly call as flu. Causative agent could be influenza viruses type A, B, and C from the family Orthomyxoviridae. Influenza A is causing very severe symptoms. This is the one responsible for pandemics and localized outbreaks. Influenza C usually does not cause pandemics or epidemics or significant disease. This can be transmitted through airborne spread and direct contact. Reservoir includes most of the time infected humans as well as pigs and birds. There's what we call this stomach flu or 24-hour flu. These are actually gastrointestinal symptoms of your influenza patients, but this is very rare in influenza class. Okay, so the pig here, as a reservoir, serves as a mixing bowl. What does it mean? Because your pig's class has both receptors of the for the avian or the bird flu and the human flu. So because of this, new strains of influenza with RNA genome containing avian and human strains will arise. Okay, so the pigs again serves as the mixing bowl. There are many strains of influenza. It keeps on emerging to new strains. That's why there is yearly or annual vaccination. Vaccination for influenza provides lifelong immunity class. However, it's not true to all of the strains. Lifelong immunity to a particular or specific strain only. Okay, so that's why annual vaccination or flu shot is very important. Next, avian influenza or bird flu. Causative agent, your influenza type A, which is responsible for the severe symptoms. There are three subtypes, H5, H7, H9. H5N1, H5N1 rather, is the most virulent strain. It can be transmitted from birds to humans. There is also person-to-person transmission, but very rare. The reservoir include infected wild and domesticated birds. So, in 1918 class, during the 1918 pandemic, it was actually caused by your avian influenza or by your avian bird flu. So, in here, it is the H1N1 strain. So, this is a poster or from the news during the 1918 pandemic. It says here to prevent influenza. I can still read it. Do not take any person's breath. Keep the mouth and teeth clean. Mas grabe ilang guidelines compared sa atong health protocols today. Avoid this. Avoid those that cough and sneeze, okay? These are almost similar to our health protocols today that we should always follow, okay? Next, severe acute respiratory syndrome or your SARS. This is not the SARS-CoV-2 that we have now. This is your SARS in 2003, caused by SARS-associated coronavirus. However, they are the same with with the SARS-CoV-2. They come from the family Coronaviridae. Reservoir is unknown mammalia, and this can be transmitted through respiratory droplets and touching the mouth, nose, and eyes. Most patients here develop dry cough with pneumonia. As you can observe, the symptoms are very similar to COVID-19 disease. Okay? Other symptoms include fever, chills, headache, body aches, and sometimes diarrhea. Yes, class diarrhea. As well as for COVID-19, because your intestines also contain a few ACE2 receptors. And I can really attest that diarrhea is true because I tested positive of COVID-19 last year, though it was not really I was not really hospitalized, but I undergo quarantine, and it was really mild symptoms that I'm experiencing. I really experienced diarrhea, the loss of smell and taste as well. The diarrhea was very bad that time. Like it's for me, it's really bad that I have to really keep on going to the CR. I also have abdominal pains, and then I know that I already tested positive with COVID-19. So let's go back. Other symptoms again includes fever, chills, headache, body aches, and sometimes diarrhea. So this SARS is outbreak happens in 2003 in China, and I think I was still in grade one that time. And I just want to share this. I know you were able to read Burton's. This line just really highlighted in my mind. The new strains of coronavirus continue to emerge. This is written in Burton's if you were reading the book. And while reading this, I really got goosebumps class because it is literally happening today. And that this line exactly I copied it. That's the new strains of coronavirus continue to emerge, and it's happening today in this pandemic. So let's all be careful, follow the correct health protocols. Next, viral infections of the oral region. First, we have the cold sores, also known as fever blisters, and labialis. Causative agents, most of the time, the herpes simplex virus 1, and your sometimes the HSV 2 from the family Herpes viridae. It may be severe and extensive in immunosuppressed individuals. Your HSV 1 is responsible for the oral herpes. HSV 2 is responsible for genital herpes. Next, viral infections of the gastrointestinal tract. First, we have enteritis, I mean viral gastroenteritis. Causative agents include enteric adenoviruses, astroviruses, calicivirus, or the norovirus type of calicivirus. You also have the rotavirus. Most often, this is self-limiting, but disease can last 24 to 48 hours if it is, especially if it's caused by rotavirus. Rotavirus class is more fatal and can cause significant disease to young children and infants. Good thing there is vaccination for rotavirus already. Okay. Reservoir includes infected human and contaminated water and shellfish. It can be transmitted through fecal oral route and airborne transmission as well as contact with contaminated fomites. Next, viral hepatitis. So, we have different types of hepatitis. You have type A hepatitis, B, C, D, E, and until G. Type A hepatitis is also known as your infectious hepatitis. Type B is also called as your serum hepatitis. Type C is also called as your non-A, non-B hepatitis. Type D hepatitis also known as yes non-A non-B hepatitis, and you have type D, type E, and type G hepatitis. Among all this class, only type B hepatitis is a DNA type virus. The rest are RNA, are single-stranded RNA viruses. And they also come from different family. For type A hepatitis, it belongs to Picornaviridae family. Type B hepatitis is Hepatnaviridae. Type C is from the Flaviviridae. The same with G, Flaviviridae. Type E is Caliciviridae. And type D from the genus Delta virus. Okay? For the mode of transmission, your type A hepatitis and your type E is via fecal oral transmission. It can be also from person to person and infected food handlers and fecally contaminated foods and water. For type B hepatitis, C and D, it can be through sexual contact. Your type B and C hepatitis is also it may also lead to cirrhosis or hepatocellular carcinoma, especially your type C hepatitis. Your type C hepatitis is transmitted as well through blood transfusion most of the time and rarely through sexual contact. Type B hepatitis also can be transmitted from mother to infant during or before birth, and also for those drug users because of the needle sticks, and also tattoos because again of needle sticks, and other type of healthcare associated transmission. Remember, hepatitis B is a very important occupational hazard for healthcare personnel. Type D hepatitis class, if the patient is tested reactive for type D, they should be reactive as well with hepatitis B virus. There should be a co-infection with hepatitis B virus if the patient is reactive with type D hepatitis. Okay? For the type of disease, um, your type A and type E does not form chronic infection class. Okay, it does not form chronic infection, but the rest actually is a chronic infection. Your hepatitis A virus is very severe in pregnant women, and hepatitis A and E are usually mild with recovery, but for A it can be severe to pregnant women. Okay, that's one, remember this. Type A hepatitis and E are transmitted through contaminated foods and water. Jaundice is also manifested for especially type A and E hepatitis. Jaundice means yellow discoloration of the sclera of your eyes and of your skin. So again, these are your viral hepatitis types. You don't have to memorize all of this in the table. You just have to familiarize, especially the important details like the type of disease, their mode of transmission, the other name as well. Okay? Next, viral infections of the genitourinary tract. Let's start with viral sexually transmitted diseases or STD. There is this angiogenital herpes viral infections or the genital herpes caused by the HSV2 primarily and sometimes or rarely HSV1. Reservoir infected human and transmitted via direct sexual contact. It could be oral genital, oral anal, or oral anal genital during the presence of lesions. Okay, this is a clinical picture of the lesions. In women, lesions are more likely in the cervix and vulva. For men, it's in the penis and sometimes in the anus and rectum if they practice anal sex. This lesions class is itchy and this is also tingling and there is soreness and this can lead to painful blisters. Okay. So there is also it can be also transmitted from the mother to the fetus or neonate during birth and pregnancy. So are you done? Okay, let's proceed. Next slide, genital warts. Genital warts, also called the genital papillomatosis, condyloma acuminatum. Causative agents are the 30 to 40 types of HPV. So again, there are 70 types of human papillomavirus, and 30 to 40 types of that can cause genital warts. Your HPV type 16 and 18 have been associated with cervical and penile cancer. Family Papuva-viridae reservoir infected human. It can be transmitted through direct contact and sexual contact, breaks in skin or mucous membranes, and also mother to neonate transmission during birth. So this is a male private part with warts, as Burton's describe it. These are your small cauliflowers look alike. Multiple warts often grow in the same area, like this, and it really looks like cauliflower glass. Okay, so Burton's defined it as small cauliflowers. Next is viral infections of the circulatory system. First, we have HIV infections and AIDS. Okay, Miss, dili din na same ang HIV and AIDS. There are actually stages class, and if the immune system already weakens, illness become more severe, and that's the time it already leads to AIDS. AIDS kumbaga is the end stage of your HIV infection. This is the time where CD4 T cells is already very low. So HIV infection is caused by HIV-1 and HIV-2 as well, but most commonly HIV-1 from the family Retroviridae reservoir infected humans. It can be transmitted through sexual contact and sharing of contaminated needles and syringes by intravenous drug users, transfusion, organ transplantation, and as well as transplacental transmission, breastfeeding from infected mothers, and as well as broken glass, syringe, needles, or scalpel injuries, which is very common in a hospital setting. So this picture is a clinical picture of Kaposi sarcoma. Your Kaposi sarcoma class is a rare type of cancer. It is a complication of your AIDS caused by herpes virus A. Again, this is Kaposi sarcoma, a rare type of cancer complication of your HIV infection. So, um, for the pathophysiology, I'll just give you a brief idea of the pathophysiology since we are talking about CD4 plus T cells. The virus actually bind to its surface receptor. Again, your virus is always specific. So there is a specific receptor for the HIV virus. They attach to the receptor, and that receptor is in the CD4 plus T cell. This is a lymphocyte class. This is one of the white blood cells. So this CD4 plus T cell contains the receptor where the HIV attach. And what happened, class? It continues to destroy your CD4 T cells and it cannot already function its normal function or role in our body, especially in our immune system. Your T helper cells, class, help in the stimulation of antibody response by B cell antibody production. So if more of it is destroyed, then that's the time magka-diminish po na to immunity, or it might be lower or decrease because more of the T cells are already are destroyed by the virus. Most of the HIV patients class does not really die because of HIV. Most of them are due to viral co-infections and opportunistic infections. For example, if they are infected with Mycobacterium TB, your Epstein-Barr virus, cytomegalovirus, your herpes simplex virus, and your hepatitis B virus. These overwhelming infections caused by these pathogens mentioned and opportunistic pathogens are actually the usual cause of disease of HIV patients. Okay. Why? Because HIV patients class, they're more prone to infection. They're more prone to diseases because they have already very low immunity. Kasi of all the cells, target naman ni HIV is the CD4 plus T cell, your T helper cell, which plays a very big role in the immune system or the antibody production as well. Next, these are the mode of transmission of HIV. I already discussed or mentioned this, but let's recall sexual contact, blood transfusion, contaminated needles, and perinatal transmission that could be transplacental during delivery through an infected birth canal as a result of ingestion of breast milk as well for infected mothers. Okay? Next, infectious mononucleosis, also known as mono or kissing disease. So it can be transmitted through direct contact with the saliva and also blood transfusion. So direct contact with the saliva, thus kissing disease. It's caused by your Epstein-Barr virus, also known as herpes virus 4. Family is herpes viridae. Your infectious mononucleosis class can be oncogenic. It is being associated with Hodgkin disease and Burkitt lymphoma. Your infectious mononucleosis virus, the Epstein-Barr virus, infects this time as well the B lymphocytes. B lymphocytes is also very important in the antibody production. So, other symptoms include fever, sore throat, lymphadenopathy, and splenomegaly. Next, mumps, or cold as infectious parotitis. I haven't experienced mumps, but I know it's quite painful. This is in our dialect called, I forgot. In our dialect, it's called bayuok. Is it right? Yeah, it's called bayuok. And this is the time where they put that blue anil for which will give actually the cooling effect to lessen the pain. Okay. Mumps causative agent is the mumps virus or rubella virus from the family Paramyxoviridae, transmitted through droplet spread and direct contact with the saliva of infected persons. Complications include orchitis or the inflammation of the testes, oophoritis, inflammation of the ovaries, and meningitis, encephalitis, nephritis, and pericarditis. So this is the clinical picture of a patient with mumps. There is swelling of its salivary glands. Next, viral hemorrhagic diseases. Causative agents, dengue virus, yellow fever virus, Lassa virus, Crimean Congo virus, Ebola virus, and Marburg virus. Reservoir are infected humans, but for Marburg virus, it could be infected humans and African green monkey. Person to person, it can be transmitted from person to person or direct contact with infected blood, secretions, or by needle stick. This picture here is an Ebola virus. It is very long because your Ebola virus and Marburg virus comes from the family Filoviridae, from the word philo, which means thread-like. So it's actually, or I mean, obviously, long and larger. Filoviruses is said to be the most pathogenic of all the hemorrhagic, of all the viruses causing hemorrhagic fever. So, pinaka-most pathogenic yung filoviruses. All known causes or cases, all known cases of Ebola and Marburg occurred and can be tracked in Africa. So, this is in Africa class, patient experiencing Ebola virus. Your dengue virus and yellow fever virus are also responsible for viral hemorrhagic diseases, but these are mosquito borne rather, from through the mosquito Aedes aegypti. Okay, these are mosquito borne by Aedes aegypti. Your Crimean Congo is a tick-borne disease. Okay, let's move on to the next viral infections of the central nervous system or the brain. First, we have lymphocytic choriomeningitis. Causative agents include Causative agent is your lymphocytic choriomeningitis virus or LCMV, family Arenaviridae, and this is a rodent-borne disease. The reservoir includes infected rodents. This includes the common house mice. So that's one reason I really don't like rodents. They carry a lot of pathogen with them. It can be transmitted via exposure to mouse urine, saliva, droppings, or nesting materials. It can also enter through the broken skin, nose, eyes, and mouth. And it can also be transmitted through organ transplantation. But most often, this is due to exposure to mouse urine, saliva, droppings, or nesting materials. There is no person-to-person transmission for your LCMV. Again, lymphocytic choriomeningitis virus. Okay. Other symptoms for LCMV include aseptic meningitis, encephalitis, and meningoencephalitis. Complication also in the brain or of the CNS includes deafness and neurological damage. Next, poliomyelitis, also known as polio or infantile poliomyelitis. Causative agent is your poliovirus from the family Picornaviridae. It more likely occur in children and adults class, and it can be transmitted through fecal oral route. In 1% of the patients, the disease progressed to severe muscle pain with or without paralysis. So this is a clinical picture of a patient with poliomyelitis. Okay, next. These are only good to know, class. You don't have again to memorize everything. These are the different vaccines of polio. You have oral polio vaccine and inactivated polio vaccine, or the OPV and the IPV. OPV is administered by drops kasi nga oral. Your inactivated polio vaccine is administered by injection. Your vaccine contains live weekend virus, meaning these are attenuated type of virus. I guess you already studied the different types of vaccines in your previous worksheets as well. So OPV, again, it contains live weekend virus or the attenuated type of vaccine. Inactivated polio vaccine contains the killed virus. This is the same with the Sinovac vaccine in COVID-19, which contains the killed virus. Kasi nga, it's being administered by drops. OPV provides immunity through the gut and associated herd immunity. Your IPV provides immunity naman through the blood. Okay, again, these are the vaccines: oral polio vaccine and inactivated polio vaccine for poliomyelitis. Next, rabies. Yes, class. World Health Organization has been really trying and with full attempt to really fully eradicate polio. Okay? So next, rabies. Causative agent is your rabies virus, family Rhabdoviridae. Reservoir, wild and domestic animals. That includes dogs, fox, coyote, wolves, jackals, skunks, raccoons, mongooses, and um, bats. Actually, there's no wolves naman sa bahay, walang raccoons, okay? So, more likely, dogs yung reason, yung reservoir of rabies. It can be also cats, class, and horses. May rabies sila, okay? It can be transmitted through the bite of the rabid animal. Rabid meaning the animals that are infected with rabies. Airborne transmission from bats in caves is possible, and person-to-person transmission is rare. Okay? Your rabies class is an acute viral encephalomyelitis. Clinical manifestations include mental depression, restlessness, paralysis, and convulsions. The paralysis starts in the lower legs and then goes to the upper part of the body. So this is a clinical picture of a patient with infected with rabies. So I put here the lines that just highlighted also to me, class. You don't have to memorize this. These are only extra lines that I want to share. During the ancient times wherein rabies first occur to patients, the Code of Ancient Mesopotamia wrote this: the bite of mad dogs to affect disease on humans. Aristotle also quote this in his book, The Natural History of Man: madness in dogs that cause them to be irritable, and all mammals they bite become disease. Okay? So, these are just lines lang na nakuha ko. Next, viral meningitis. It's also called a septic meningitis, non-bacterial, and a bacterial meningitis. Causative agents: enteroviruses, Coxsackie virus, arbovirus, measles, mumps, herpes simplex virus, your varicella zoster virus, your lymphocytic choriomeningitis virus, and adenovirus. Next, viral encephalitis. Your viral encephalitis is an arthropod-borne. Causative agents include St. Louis encephalitis virus and West Nile virus. It can be transmitted through organ transplantation, transfusion, and breast milk of infected mothers, and also transplacental. Person-to-person is rare for viral encephalitis. A patient may be asymptomatic, or they may have mild fever and headache. So this is a tabulation of the arthropod-borne viral encephalitis. You don't have to memorize all of this, at least just familiarize, especially the most important ones like the disease and the vectors. So I'll just show you, class, the different types of herpes viruses from the family Herpes viridae, because we kept on mentioning it in our previous slides, and then you might be confused. There are 8 types kasi, and one is your herpes simplex virus 1, also known as oral herpes, your HSV2, your type 2 of herpes virus is also known as your genital herpes, or responsible for genital herpes as well. Type 3 is your varicella zoster virus, type 4 Epstein-Barr virus, type 5 your cytomegalovirus, which is said to be congenital. You also have herpes virus 6, 7, and 8. Okay? Next, these are only recap of some major viral infections of humans. Again, just familiarize all of these. Like AIDS caused by HIV, avian influenza, bird flu caused by avian influenza viruses. So just familiarize as well all of this, okay? So that sometimes magig class the disease or the pathogen will give you clue to their type of disease, to their type of infection, and the like, okay? Brain check. I only have one question. Do not worry. One virus is the most common. What virus is the most common etiological agent of viral respiratory diseases in infants and children? So what's your answer? The correct answer is letter A. That's RSV, respiratory syncytial virus. Remember that highly affects infants and children, and responsible for bronchitis, croup, and pneumonia among infants. So the answer is RSV. Okay, that would be all for the viral infections of humans. So thank you so much, class, for listening. I hope you were able to learn. Again, you stick with your Burton's Microbiology for Health Sciences, your SAS modules and lecture presentations. God bless you, class. Study smart and have a great day ahead. Thank you so much.